All right, let's talk about nausea and vomiting. You know it, I know it, it's one of the top complaints we hear every single day behind the counter. And the cause is, they can be all over the map. So today, we're going to build a really practical playbook for how to manage it like a pro. Let's get right into it. So picture this. Your next patient walks up. They look miserable. They just say, "I feel sick to my stomach." It's vague, right? But that's where our work starts. What's your immediate game plan? What are the first 3 questions that pop into your head? We're going to build a clear, structured approach for that exact moment.
So here's how we're going to break this all down. We'll start by reframing the problem itself. Then we'll walk through a solid assessment. After that, we'll cover non-drug and drug options, apply it all to a couple of really common scenarios, and wrap it up with a handy little cheat sheet for your practice.
Okay, first things first. We have to get this core principle straight in our heads. Nausea isn't the actual problem. It's a signal. It's an alarm bell going off, and our job is to figure out what's pulling the alarm.
I mean, that's the textbook definition, right? An unpleasant sensation. But the key takeaway for us is that last part. The underlying cause should be determined. So before we even think about grabbing a product off the shelf, our main job is to investigate. A good outcome totally depends on us uncovering that root cause.
And that brings us right to our most important role here, becoming a symptom detective. We need to have a system, a reliable way to gather all the clues that are going to lead us to the right recommendation.
You know, our most powerful tool in these situations isn't just our pharmacology knowledge, it's our ability to ask great questions and take a really thorough patient history. That conversation is everything. It's the foundation for an accurate assessment and a management plan that actually works.
So, what does that conversation look like? Well, it's a step-by-step investigation. We need to know the what, when, and how of the nausea. How often is it happening? How bad is it? Are they actually vomiting? And this is huge. We need a complete medication history. I'm talking prescriptions, OTCs, that new herbal tea they started, everything. Then you dig into other symptoms and recent exposures to really paint the full picture.
And here are some of those high-impact critical questions. For any woman of reproductive age, asking about their last menstrual period is absolutely non-negotiable. We have to rule out pregnancy. Did a doctor just change their dose of something? Are they showing signs of dehydration, like feeling dizzy? And don't forget, sometimes the cause isn't physical at all. Stress can be a massive trigger. These questions help us triage fast and spot any red flags.
So now that we've gathered our clues, we can start putting together a plan. And the foundation of any good plan, for every single patient, every single time, starts with the non-drug strategies.
This is where our counseling really shines. The advice might seem simple, but man, it is effective. You know, small, frequent meals are so much gentler on the stomach than big ones. Helping them identify and just avoid their triggers is huge. And look at the detail in the hydration advice. For a mild case, yeah, water is fine. But if they're vomiting a lot, we need to be specific and recommend an oral rehydration solution to replace those electrolytes. That's a critical piece of counseling. Okay, so once that non-drug foundation is in place, then it's time to think about our pharmacologic tools. And this is all about picking the right tool for the right job for the right patient.
Let's talk about the #1 cause we see, viral gastroenteritis. The evidence is pretty clear that there's no single best antiemetic here. So our first choice is often a practical one. A first-generation antihistamine like dimenhydrinate is a really solid starting point. And you can tailor it. Maybe the patient could really use the sedative effect to get some rest. That's a win-win.
Okay, let's compare the 2 main OTC players for motion sickness. For a short car trip, dimenhydrinate is a great choice. But here's the key counseling point. They have to take it at least 60 minutes before they travel. Motion sickness slows down the gut, so it needs that head start. For a longer trip, like a cruise, a scopolamine patch is way better. But again, timing. It needs to be on at least 4 hours beforehand. And please always warn parents that antihistamines can sometimes make kids wired instead of sleepy.
So let's put all this knowledge into action. We'll walk through 2 scenarios we see all the time, motion sickness and that tricky opioid-induced nausea. With motion sickness, it's all about prevention, not treatment. You can literally use this timeline as a counseling tool for your patients. Patch goes on 4 hours before. Avoid a big, greasy meal. Take your pill an hour ahead of time. And then even during the trip, simple tricks like staring at the horizon can make a huge difference. It's about being proactive. Now for opioid-induced nausea, a really common and frustrating side effect. Our first instinct might be to just throw an antiemetic at the problem. But a more strategic step-by-step approach is way better. First, can we just try adjusting the timing with meals? If that doesn't work and their pain is controlled, maybe we can talk to the prescriber about a small dose reduction. Step 3 is considering a switch to a different opioid entirely. Then, and only then, if none of that works, do we add an antiemetic.
All right, let's bring this all home. We're going to wrap up with the final practical cheat sheet you can take right back to your practice. So let's just boil this down to some quick do's and don'ts. Do start low and go slow, especially in your elderly patients. Do remember we have other options like suppositories or patches if someone can't keep anything down. And always reassess if plan A doesn't work. On the flip side, don't forget a quick drug interaction check. Don't be afraid to switch to a different class of antiemetic. And most importantly, don't overlook those non-drug options first. At the end of the day, managing nausea is a perfect showcase of our value as pharmacists. It's about taking our deep knowledge and applying it through smart questions and great counseling. We're not just handing over a product, we're providing a solution. It's about transforming that common symptom into a solved problem, and it all starts with our expertise.